small dogs. We have 38 big dogs still here and 88 cats. So
do that, because last year we had like a dozen cats left.
We can do this. We can do this.
A few minutes ago, I told you the story of Peggy, the three-legged dog in Grapevine. Well, one of the doctors that operated on her is right here, Dr. Tanaja Crocker. Come on over.
How are you?
Okay, last time I saw you, you were in scrubs and hand deep. Thank you for making sure I didn't go too inappropriate. But thanks for being here.
Yeah, you're welcome. I'm very excited. This is my first time to go to one of these events.
What do you think?
I'm very impressed. I didn't realize how many people it took and then how many animals are available here. And then I know Grapevine is involved in it too, and obviously that's where I work, and so it's very exciting.
Tell us a little bit about your vet clinics, the services you offer, because there are a lot of new pet owners today who might be looking for a new veterinarian.
Yes, well, Northwest Animal Hospital in Grapevine, and we are preventative medicine, and then we also do spay, neuter, vaccines, things like that. And specifically with the shelters, we will see the animals, especially the ones that maybe have illness going on or sickness, that they want to make sure are healthy enough for adoption. So we do a fair amount of surgeries, spays and neuters, vaccinating, and just making sure that when people take these pets home that they're going to have a healthy pet. And then I usually will recommend you take your pet, once you've adopted them, to your veterinarian within the first week or so, just to make sure that there wasn't anything that was missed or that needs to be identified. So.
How rewarding is it for you to see these animals going home?
It's amazing. And you know, animals are just amazing in the fact that, like Peggy, I mean, she had a broken leg with bones sticking out, and she was the sweetest, friendliest, like loving on us dog, and we were able to help her pain, and then she found a new family, you know, and they brought her into us since then. Yes, we got to see her. We were so excited, and she looks great, and she's super happy. And so being able to do that when, you know, you mainly see animals that have been taken care of for a while, and then you just see these pets that have such good hearts, and you can help them and then help them find a brand new home. It's very, very rewarding. So.
I also love that you all work with shelters as far as how much they have to pay for these huge surgeries like Peggy had. Why is it important for you to support them?
Well, obviously they have limited funds, and so we want to help them. And then just them being part of our community and what they're trying to do, we can kind of help them to do the things that normally they wouldn't be able to do with their limited funds by offering our services, and then helping identify things without having to maybe do as big a workups after they've already been adopted. And so it helps them to be adopted, I think, saying, this is a healthy pet, we've already fixed this, and this is what you have to expect. And one thing, you know, in this area is heartworms, and so the shelters are big about testing for that, and then we can also help with treatment for that. So I think that, you know, that's really, really important, and I think the shelters are good about doing that.
You know, one of the great things about adopting an animal at this event is that you know when you get that animal that you're good to go. It's going out the door healthy. All of these animals have been checked out.
Yes, they've been checked out. They have their rabies vaccines, which is huge. Most of their basic puppy and kitten shots also have been at least started. Sometimes you can't do them, you know, except a month apart. So that's, again, why you need to follow up with your vet. And then spay and neuter has also been done. So the things to watch for when you get home would be maybe some respiratory stuff that might develop later. So coughing, sneezing, which is really normal in these high population areas. And easily addressed if you go to your vet. And then skin conditions. That's another thing in Texas in general that we struggle with. And so those would kind of be the things to watch for in the first couple of weeks. But for your basic big diseases that you're worried about, the shelters are great about making sure they're sending them home and that they're healthy. So.
One thing I loved about being at Northwest Animal Hospital was that all of you, like, you love animals. Like, it's not a job.
No, it's funny because I knew I wanted to be a veterinarian since I was 6 years old, and I did it, and I didn't realize how many people don't always love what they do every day, but I love going to work. I really do, and our environment is one where we really love our patients and we love our pet owners, and so personally, obviously, I love our hospital in general, but we really do. All of us that work there love what we do for a living. So.
And I know as a pet owner, my veterinarian is like a member of my family. I mean, there's quite a bond that develops between people and their pets and their veterinarian. It's extraordinary.
And that's what we love is seeing people when they get a new pet, and then you get to see them over the years and experience ups and downs with them. You know, there are some hard times too, but having that relationship where you trust each other and you understand that the vet does what's best for your pet, and they're there to help you as much as they can, because we understand that they're a huge part of your family, you know, so we want them to be okay.
And you have pets, I'm assuming.
I do. I have, obviously, I have 2 dogs and a cat, but I also have a 1-year-old and a 5-year-old child. So right now, my daughter's actually here with me and trying to convince me that we need another one, but it maybe wasn't the best decision to bring her, so we'll have to see by the end of the day how many we have.
Would you please let us know if you adopt from this shelter?
Yeah.
You gotta swing back by.
Let you know. She's working me pretty good, so we'll have to
Dr.
see.
Tanisha Crocker, thank you so much. Northwest Animal Hospital in Grapevine.
Check it out.
Thank you.
Thank
All right.
you very much.
For the work you do.